Asbestos is a known carcinogen, and there's no safe level of exposure.
Mesothelioma is a miserable disease.
They must fight a truly global battle.
We want to demonstrate our enormous respect.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.
Juan Carlos contacted us and asked if he could speak at the conference. Being from Brazil and knowing Fernanda, I wasn't sure what this actually meant. I did some research and made some calls, and what Juan Carlos wants to talk about today is something very exciting, that safer substitutes, as the World Health and USGS and others know, exist. They're also economical. And now you have an expert who runs a business in Brazil who's going to share with you the methodology in his business. So please join me in welcoming Juan Carlos.
Ladies and gentlemen, banning asbestos in Brazil, progress and problems. In the paper, I will try to explain the progress in banning asbestos in Brazil in legal and technical terms. Given the scientific consensus about the lethal effects of exposure to asbestos, the International Labour Organization, in its 162 Convention on June 4, 1986, decided to address the issue of asbestos. At this convention, the signatory country, including my native Brazil, undertook to carry out the following treaty obligations. A, to substitute as soon as possible all type of asbestos with other material which are harmless to human health. B, where substitution is not possible, to take every possible precaution to prevent the exposure of workers and the public at large to asbestos fibers. Approximately 66 countries, among them all the members of the European Union, have already complied with the obligation to prohibit the use of all types of asbestos. In 1995, in Brazil, law number 9055 was promulgated, which included, in summary, the following measures. A, it imposed a total prohibition of the use of the all type of asbestos except chrysotile. B, in view of the impossibility of banning all uses of chrysotile and considering the lack of technological alternative and materials, adopted the restrictions and precautions required under Island Convention 162. It kept in force the standards mentioned in the International Agreement regarding asbestos, which include ILO 162, to ban asbestos as soon as feasible. ABFIBRO, the Brazilian Association of the Industries and Dealers in Fiber Cement Products, which I am proud to serve as president, has its main purpose the promotion of the use in Brazil and other countries of fiber cement products manufactured with environmentally friendly technology and raw materials which are safe for both workers and consumers. The technological evolution intended by ILO 162 has actually occurred. These new technologies are already being utilized in Brazil, due in part to the efforts of ABFIBRO, and those manufacturing methods have been mastered by the fiber cement sector, which accounts for approximately 98% of asbestos consumptions in our country. In Brazil, asbestos-free fiber cement products have been successfully manufactured since 2001, employing alternative fibers such as polypropylene and PP, polyalkylvinyl, imported from Japan and China. These alternative fibers are harmless to human health. On July 13, 2004, the Brazilian Ministry of Health, through its ANVISA, National Health Surveillance Agency, determined that they are neither carcinogenic nor responsible and expressly recommended their use as a replacement for chrysotile, a non-carcinogenic for human beings. A quick perusal of their websites will show that since at least 2006, most companies in Brazilian fiber cement sector have been ready to able to eliminate asbestos from their products. The economic feasibility of adopting a technology alternative to fibers in the Brazilian fiber cement industry is perfectly demonstrated in this study, carried out at the University of Campinas, Unicamp, one of the Brazil's most respected institutions of higher learning. Persons interested in the study can download at copy at www.abfibro.com.br. Therefore, the main barrier to the elimination of asbestos from building material is a political one caused by the lack of national-wide legislation which would oblige them to do so. Given this omission by the federal government, several states, such as São Paulo, Rio de Janeiro, Rio Grande do Sul, Mato Grosso, and Pernambuco, have promulgated laws which ban of the use of asbestos, as well as asbestos-containing products within their respective territories. Those states' laws banning asbestos have been criticized, however, as unconstitutional by those who have a clear economic interest in continued use of asbestos. They often make false claims regarding the ILO 162 Convention, stating that the mentioned convention allows for the safe and controlled use of chrysotile. On June 15, 2006, during its 95th International Conference, the ILO expressly pointed out that its 162 Convention could not be used to endorse or justify in any way the continued use of asbestos. In an attempt to reach a final solution to this problem, Brazil's National Association of Labor Prosecutors, as well as the National Association of Labor Judges, initiated on April 20, 2008, a joint petition to Brazil's Supreme Court asking for ruling on the unconstitutionality of the Article 2nd of Law Number 9055, which appeared to permit the mining and sale of chrysotile asbestos in Brazil. Also, the constitutionality of the state laws that ban asbestos has been affirmed, or the unconstitutionality of Article 2nd of the federal law will be decided we will have taken an important step towards the elimination of asbestos. These judicial procedures, however, take a long time. What Brazil needs is a federal law which bans chrysotile asbestos. The promulgation of such law would bring Brazil into compliance with the international obligation undertaking the ILO Convention 162, along with the constitutional obligation to defend the dignity and health of all human beings. Such a law would also acknowledge and lend support to the technological development already in progress. In other words, it's already feasible and totally necessary to ban asbestos in Brazil. Taking into account the above-mentioned facts, I request that representatives of ILO, WHO, and other similar entities send suggestions to our government to encourage it to carry out its obligation to substitute chrysotile asbestos, an obligation which was undertaken at the 162 ILO Convention, considering that we already have technological capacity to do so. Dr. Oscavo Correa Neto, ABFIBRO's legal director, will be present and available to answer questions about the legal issues which surround the asbestos in Brazil. Dr. Neto has testified on these subjects before Brazil's Supreme Court, as well as before many other courts and regulatory agencies. Finally, on behalf of our association and of all the people in Brazil, we would like to show our appreciation to Steve McQueen and his widow, Barbara McQueen, for her work on behalf of asbestos victims. We would also like to give you our profound appreciation to ADAO and its organizer, especially Ms. Linda Reinstein and her experienced team for giving us the opportunity to present a summary of the Brazilian situation related to the asbestos. I hope to see you all again in Brazil at the Rio Plus 20 United Nations Conference and to continue to work together on our common goals. Thank you all.
Keep up the good work. I look forward to the day when ADAO is no longer needed.
Fix it. Fix it. Everything in the world can be fixed.